Changes to healthcare at the federal level. What will be the role of insurance agents? I'm Jill Horner. This is Comcast Newsmakers. With me this hour is Gary Wevadau. He is the healthcare chairman for NAIFA. Thanks for being with us.
Thank you, Jill.
Talk to us a little bit about your membership and how changes at the federal level will impact them. What will be the role of insurance agents?
Well, that's a very fair question, Jill. What we see, the role of an agent is what they've always done, but becoming more of an informant to the small business community, a trusted advisor like a CPA, like your attorney, helping to educate and inform the public. Our primary role with small business is to help them make decisions that make sense for their business and help them to save costs whenever able by implementing types of programs, consumer-driven types of programs, HSAs, HRAs, FSAs, and some of the changes along with those that make sense for their employees in the midst of the healthcare reform.
So let's talk about some of the things that have already come out of this healthcare reform, because this is rolling out incrementally. One of the changes that's already happened is that dependents under the age of 26 can stay on their parents' plans.
Correct. I would have to say that's a positive change. They've been termed the young invincibles by the industry. A lot of times when they get out of college, they go without coverage, and then there's accidents and sometimes high claims involved. That is a positive. That's only impacted a cost value of about 1 to 1.5% to the bottom line. So that's a very positive change.
Now, lifetime maximums have actually been repealed.
Lifetime maximums have been repealed, as well as annual maximums incrementally over time. That's a positive. It's very rare for most claims to go over a lifetime maximum, but it's those catastrophic claims that you don't want to be impacted. Again, that's another positive to the healthcare reform.
What about the tax credits for small employers?
Tax credits, I think, are very valuable, especially to the very small business who's impacted the most by this. When health insurance companies rate insurance plans for small business, it's based on several factors. The age of the average age of the employees, the type of business, claims history is always a factor. They look at pre-existing conditions. They cannot exclude pre-existing conditions, but it's a factor in rating a policy. So the ones who suffer the most are the smallest businesses, anywhere from your mom and pop type of businesses up to groups of 30, 40 employees. The new tax credit affects small businesses of 25 or less full-time employees and making less an average $50,000 a year or less for their employees. So that goes into effect this year and also rolls out over time incrementally as well.
Now, you mentioned pre-existing conditions. What about for children? What are the changes there?
Dependents age 19 and under, no longer can an insurance company hold that against someone. But this is a very reactionary type of business. Most of the health insurance companies have pulled those types of products off the shelf to offer them individually to children under the age of 19. So when things go into law, it sounds good, but the industry does react to it, and they're not going to stick their neck out on that one.
And we just have a minute left, but what do you see as the overall impact on small businesses related to these changes at the federal level?
Very fair question. Been doing this for 20 years, and any time that the government comes along and mandates changes to an insurance program, it sounds good and it is good, but there's a cost. It comes at a cost. And unfortunately, at the end of the day, it comes out of the cost of the employees and out of the employers.
All right, thank you very much. We've been talking with Gary Wevadau, the healthcare chairman for NAIFA. I'm Jill Horner for Comcast Newsmakers.